recording. It's asking me about AI. Okay. All right. Hi, everyone. We have our event today that we're going to talk about. Well, hold on. Let me just open up real quick so I have some notes. Okay, so we really wanted to have this talk with Dr. Dawnn Thomas because we wanted to understand from her dissertation work about the experience of API students in OT programs. And so really thinking about their stories of belonging and representation and what their experiences were within that academic setting. And especially as educators, what we can do better to support our API students across the country in the various programs. I will say just a personal note, I do get a lot of messages from students from time to time, or messages from students connected through the association who say, I'm in an OT program in this state and I'm like the only API student. And so that's something that I commonly hear. And I'm always really curious about the student experience, especially in a program where we're not very well represented. And so that's why I was really excited to have you to join us, Dr. Thomas. So I'm going to also do a quick introduction before we get started. So I have your bio. Hold on one second. Let me pull up your bio. Okay. So Dawnn has been an occupational therapist for 19 years, and her passion for the profession continues to grow. She earned her Master's of Occupational Therapy in 2007 from State University of New York at Stony Brook, completed her post-professional doctorate of occupational therapy in 2012 from Chatham University, and most recently achieved her PhD in occupational therapy in 2025 from Nova Southeastern University. So her research centers on the lived experience of Asian American students in entry-level occupational therapy programs in the U.S., with a broader focus on the importance of diversity, equity, and inclusion in occupational therapy education and practice. Throughout her career, she's had the privilege of working in skilled nursing facilities, acute care hospitals, home health care, and most recently in home-based outpatient settings. These experiences have shaped her understanding of the diverse needs of individuals and families across the lifespan and continue to inform both her teaching and research. She served as program director for a master's level OT program and later for the OTA program at Warwick Community College, where she currently maintains. While she values leadership and program development, she continues to engage in clinical practice because working directly with patients reminds her of why she chose this profession. She's especially passionate about mentoring students, helping them grow into culturally responsive, reflective practitioners, and supporting future occupational therapists as they develop competence, confidence, and a commitment to inclusive care is one of the most meaningful parts of her work. So we're very honored to have Dr. Dawnn Thomas. I'm going to pass it off to you to get started.
Okay, thank you. So I'm going to go ahead and try to share my screen. Hopefully, this works for me. Are you able to see this?
We see this, I think it's like with the note page though,
Oh,
and presenter view,
okay.
and it disappeared.
How's that? And now?
Not yet.
Okay, let me see. Let me go back to.
If you want to keep it in that view, that's okay.
Oh, how's this? Does that work?
Don't
No.
see anything. Don't see anything.
Okay, let me try one more time to see if this works. It's crazy how like this is all I did for a little while during COVID and everything, and now I can't figure it out. Okay, if I make this bigger, can you see that?
That works.
I wonder how let's full screen, entire screen. Okay, can you see that?
Yep, we can see that.
Okay. And so you can see, oh
Oh,
my
it just
goodness. Okay. Maybe I shouldn't do that. Can you see this?
no.
No,
Are you
okay.
maybe sharing on a different screen? Oops.
All right. Well, thank you for joining me. Karen did a great job of introducing. So, for the sake of time, I won't talk too much about myself, but I just wanted to let you know that this was what my dissertation was about. So, I had started collecting data, doing my research interviews in 2024, and then data analysis in 2025. And then I defended my dissertation in August of 2025. So, we all know that the political climate is rapidly changing. So DEI is kind of a touchy subject nowadays. And a lot of schools have to really dance around that topic. So I struggled a little bit because it changed a lot while I was doing my research, but I'm here today to present to you the research in a similar format that I did for my dissertation defense. Okay, so I'll go ahead and get started. So, as I said, I had defended my dissertation in 2025, right? So we had AOTA Vision 2025, which said that as an inclusive profession, OT maximizes health, well-being, and quality of life for all people, populations, and communities through effective solutions that facilitate participation in everyday living. And then in 2025, AOTA updated their vision to 2030, which talks about how OT enriches life for all individuals in society through meaningful engagement in everyday activities. So, whether we want to believe it or not, so by 2050, the U.S. Census Bureau is predicting that United States will be a majority minority nation. So that is why cultural humility is so important for us to avoid assumptions and biases when we're working with our patients to provide care that is respectful and person-centered and just being culturally responsive. So when we talk about cultural humility versus cultural competency, it forces us to be open and curious and collaborative and really recognize that the clients are the ones that are co-experts in their lived experiences. So really, we are all aware that Asian Americans are the fastest growing racial and ethnic group in the United States. In 2021, Asian Americans were 7% of the adult population. It is projected that by 2060, over 46 million, which is over 10% of the population, will be Asian American, making Asians the largest immigrant group. So even though there is such a growth in the Asian population in the United States, we really remain underrepresented in occupational therapy. So Zippia reported that 9% of OTs identify as Asian, and the AOTA 2023 Compensation and Workforce Survey reports that 5% of OTs identify as Asian. So what this really indicates that there's a mismatch between the population trends in the United States and OT workforce diversity. And on top of all that, there is really limited research that exists on Asian American experiences in OT. So it's important to understand this population because we want to be able to ensure that we are providing equitable and culturally responsive care. I do want to let you know that Asian American encompasses a lot of different, areas. So when I say Asian American in this presentation, I am referring to individuals in the US who can trace their roots back to East Asia, Southeast Asia, or the Indian subcontinent. Okay. Um, let's see. So there is a lot of research that says that patients often experience better outcomes when their healthcare providers share their same background, whether that's racial, ethnic, or cultural. And these benefits include increased trust, improved communication, and really stronger shared decision making. There's also challenges in occupational therapy because for those of us that are educators or, we've all been through an OT program, OT education is often taught from a Western lens. So there's a lot of emphasis on individualism, whereas Asian cultures really value collectivism. And the other thing that might be unique about Asian American families and cultures is that there are cultural and familial pressures that may influence career choices, leading even fewer Asian Americans into OT. So, really, there is racial and ethnic concordance in OT is really limited, despite 52% of Asian Americans saying that they prefer a provider who shares their same background. This was particularly true for recent immigrants or those who were early on in their language acquisition. So really low representation makes it challenging to achieve culturally concordant care. There are a lot of stereotypes that affect Asian Americans in OT, and I'm sure that we have all heard of some of these here. The biggest one probably is a model minority myth, and that really suggests that Asians are naturally successful, educated, healthy, and wealthy. And this really leads to assumptions that support that I'm sorry, this really leads to assumptions that research is not necessary. Some people say, well, why are you ashamed of that stereotype? It's a positive stereotype, but it contributes to deminoritization, and which is the idea that Asian Americans don't need to be considered a minority in studies and in policy. And then we have the perpetual foreigner stereotype, which means that Asian Americans are usually viewed as outsiders, even if they've been here for a long time, many generations, or even if they're citizens. Um, and then, of course, the both of those stereotypes fuel Asianization, which really looks at Asians as a monolithic group. So really ignores our individual identities, our experiences, and our needs. So there's really a significant lack of research on Asian Americans in OT. So for my research, the statement of the problem, the issue is that Asian Americans are the fastest growing racial group in the United States, as we talked about, but yet they still remain underrepresented in OT. And underrepresentation exists both in OT practice and in research on diversity within the profession. And this is important because when we have limited data, it makes it difficult for us to understand the unique experiences of our Asian OT students and practitioners. So that leads to research neglect. And when there's research neglect, it contributes to the invisibility of discussions of health equity and culturally responsive care. So without representation, OT may struggle to meet the needs of the diverse patient population, in this case, particularly of the Asian American patients. So what I really wanted to do here was I wanted to explore the lived experiences of Asian American OT students in entry-level programs in the United States, particularly in regards to Asianization and reconstructive history, which we'll talk about. Um, I wanted to give the students a way to give them a platform for their voices to be heard, but also contribute to the inclusive OT educational practices and research. I did use IPA, interpretive phenomenological analysis, which is a type of qualitative study. And the reason why I did that is because it really works with in-depth reflective insights from the participants' perspectives. And I found it was really perfect for exploring personal experiences in OT education. What makes IPA unique in qualitative studies is that it uses a double hermeneutic approach, which basically means that there's two layers of interpretation. The participants are interpreting their own research, their own experiences, and the researcher is also interpreting the participants' interpretations. So that's what makes it a double hermeneutic approach. Um, so again, IPA was pretty fitting because it's great for emotionally complex underexplored topics, which this really fit for, and it uses small sample sizes. And the whole point was to build a deep connection with the participants. So it could be very controversial, but I did use critical race theory. And I'm not sure how many of you are aware of this, but there's also a branch of critical race theory specifically for Asians. So that's Asian critical race theory, also known as Asian crit. And we'll talk about that in the next couple of slides. So there are 7 core tenets of Asian crit, and the 2 that are highlighted here are the ones that I focused on. So the first one is Asianization, which we did talk about Asians being seen as perpetual foreigners and model minorities, which really erases our uniqueness. And then reconstructive history, which really talks about how Asian American stories are often erased from US narratives. OT aside, I can tell you that even my kids who are in elementary school and middle school do not hear much about Asian history at all. So, and then of course in OT programs, there's a very westernized approach as we talked about. There are other core tenets of Asian crit as well that kind of branch off of critical race theory, but I won't talk about them in detail here, just for the sake of time. So what I was really studying for this research I wanted to are the lived experiences of Asian American OT students in entry level programs, specifically regarding Asianization and Reconstructive history. So my sub questions were, how do they negotiate Asianization and how do they negotiate Reconstructive history? So I was able to do all of my interviews via Zoom, and so that enabled a wide diversity of geographic locations. And participants kind of joined from wherever they felt comfortable. Um, and so some benefits, they didn't have to travel, we didn't have to travel, and it was pretty convenient. I was able to recruit 10 Asian American OT students, and I did that from emails to program directors, social media posts, AAPIOT outreach as well. And then I wanted the participants to not only identify as Asian American, which obviously um, that's self-reported. So we did have some biracial students as well, multiracial. They had to be enrolled in either a master's or doctoral OT program in the US. They had to have completed at least one semester of OT coursework. They had to be proficient in English and be able to use Zoom and have to volunteer to be part of it. I did exclude anybody who was a former OTA and anyone who was enrolled in a post-professional OT program. And I basically did that because I wanted to target students who were just beginning their educational journey in the fields of OT. So of my 10 participants, I was able to recruit 9 females and 1 male. They all range from 22 to 30 years old. Ethnicity, I did have 4 Chinese students, 3 Filipino, 1 Chinese and Filipino, 1 Filipino and white, and one that was Chinese, Black, and Hispanic. And the school regions were from the South, the West, and the Northeast of the United States. Um, I don't want to spend too much time talking about interview procedures, but of course, everything was one-on-one, everything was recorded. I received informed consent from everyone. So after I crunched the data, I was able to come up with 6 main themes and 12 sub-themes, which I'll talk about in the next couple of slides. So the first theme was cultural disconnect and lack of representation. So this is pertaining specifically to their OT program. The sub-theme was superficial inclusion of cultural content. So I want to tell you a participant quote. Unfortunately, I feel like culture has not been something that's come up very much in any of my coursework, which is actually something that I'm looking at in my own research. It's only come up kind of on a voluntary basis. When a student chooses to share or through discussion in a club, we have COTAD, but culture doesn't come up specifically as a topic in class, even when talking about the history of OT. It's not something that mentions culture at all. I don't know if culture is involved in the history of OT, but unfortunately, it's not something that's brought up. So this particular participant did not believe that they had any specific projects or assignments that emphasized their cultural background, despite her being interested in cultural assignments. Um, Another sub-theme was need for improved cultural competency training. So one participant said, I think that aspect of teaching someone to ask the right questions in the most respectful ways is so important. And this is making me wish my professors talked about this more. It'd be really nice to hear, especially since so much of OT is gained from experience, but someone has to teach you. I'd rather learn from them as opposed to making a mistake and offending somebody. So this participant really demonstrated her desire for a more culturally competent, responsive education within her program, especially when it comes to how to respectfully interact with patients of diverse backgrounds. And this participant specifically desired that her faculty played a more active role in preparing her for actual real life interactions with people of various cultures. So Asian American experiences were often underrepresented or superficially addressed. And that really led a lot of the participants to feelings of isolation. And some of them felt that cultural content was present, but it still lacked depth and practical application. Participants did express a need for deeper understanding of diverse cultures, training on culturally sensitive communication, and skills for providing inclusive, responsive care. Um, and this really points to significant gaps in cultural competency training, which really suggests a need for future research and curriculum development. The second theme was striving for belonging and acceptance in academic spaces, with the sub-theme being cultural connection and shared experiences. So one participant said, in a diverse cohort, it's so encouraged to bring your own perspective of your own culture into your program. It is encouraged if you want to share. If any of us do share any bit of our own experiences just in life, that's appreciated by the professors. I hope that any future OT student looking at a program considers how their interviewer speaks to them and looks up people's experiences at certain universities. They should be able to find a program that also encourages that diversity in a field that sometimes doesn't look diverse. But even if you are the only Asian in a group, that you are hopefully surrounded and supported by people and you never feel like an outsider to the others in your program. So I found this to be a very significant quote because what she did was she highlighted the importance of feeling culturally supported and the impact on her sense of belonging and acceptance. And this participant really stressed the importance of finding a program that actively supports diversity because that helps students not feel isolated. And she believed that OT programs that value diversity and cultivate feelings of belonging provided future OT students with really meaningful educational experiences. So, within the same theme, but a different sub-theme, diversity as a foundation for belonging, this participant said, "My friend who is also in OT school, she's one of two people of color in her cohort, which is kind of disheartening. I've had conversations with her, like how she feels, and she was telling me that she does feel like sometimes it's exhausting for her to try to relate to other students. Not that she can't make friends, but she can't make friends with people who really understand the way she grew up and stuff like that." I would tell future students to take something like that into consideration. I hope they can find a program where they feel a sense of belonging. That's really important no matter how long the program is. You are with these people for a long time and you want to be able to make friends and not feel like you have to hide part of yourself and feel like you always bring that different perspective. So this participant really discussed the risk of being one of only a few students of color in predominantly white OT programs. And she believed that underrepresentation created a situation of students being present, but not necessarily understood. And she advised future students to find a program where they can be their full selves without the need to defend or hide their identities. So the participants sought to feel seen, accepted, and valued in their OT programs. And unfortunately, feelings of isolation were common, especially if they were one of just a few Asian American students or the only one. And there were some participants that intentionally chose programs where they could be themselves and feel a sense of belonging. And an overall theme is that genuine inclusion and cultural respect was highly valued. And a lot of our participants had peer connections with others with shared backgrounds because that increased comfort and validation. And when they had feelings of I'm sorry, having a sense of belonging really helped to reduce feelings of feeling othered and gave them greater academic support. So this was a theme that was pretty strongly supported by all of the participants. The third theme was emergence of cultural pride and advocacy, embracing and sharing cultural identity. So this was a student who attended an HBCU, and she said, I would say be proud of who you are. Don't not share your Asianness or not share your culture. Let them learn about it. Yeah, just take any opportunity you can to help others learn about different cultures or their culture, I think would be cool. We can talk about our experiences, and I was able to learn about my classmates and also share my experiences like regarding healthcare and us being minorities. So I was really glad that I was able to get those experiences from the program. So this was the only participant I had that was part of an HBCU, and she believed that the diversity within her OT program really created a space for students to learn about each other's cultural backgrounds. And she really highlighted the importance of being proud of one's culture and heritage and to share their culture so that other classmates can better understand different experiences and provide culturally responsive care to future patients. Um, and she really indicated that she had an appreciation for being able to talk about her own background as a minority student. And she felt that the program gave her a meaningful opportunity to not only share her story, but to learn from others as well. Um, a sub-theme for theme three was advocacy for underrepresented communities. A relevant quote is seeing how these different factors affect the people around us, like our family or loved ones that we hold close, just kind of bring up feelings of grief of people that we've lost or people that are going through these conditions. It feels like you just have a bigger emotional connection to potential patients in the future. I feel like all the things that I've done in my career life and also in my personal life, going through grief, like having older parents and really loving working with the Filipino communities. I feel like all those things really led me to seeing what OT is and how I can use it to benefit my community. So this participant really discussed how her personal life has influenced her current path. So she made the decision to enter OT, not just for academic reasons, but also because it was deeply rooted in her own life narrative. And she had a strong sense of cultural connection and responsibility to her Filipino community. And she really felt the desire to serve and heal through OT, especially within her own cultural community. I found that there were a lot of students that really wanted to give back to their own communities. One student said, I've done a lot of research on how the race or the culture of the clinician definitely impacts a lot of care and like what demographic chooses to go there. And I've also experienced it myself with my family. We only go to Chinese doctors. My grandmother only has Chinese clinicians. It's hard to skew away from it, especially for patients who don't speak a lot of English because it's hard to communicate, especially if they have different dialects or they speak a language that's not as commonly spoken. But it brings that level of cultural understanding that they expect if you are someone of a similar background. But why I want to come into OT was also to advocate in the Asian American space. So this particular participant viewed OT partly as as a professional calling for her. She had a desire to enter the field not only to practice, but she really wanted to serve and advocate for Asian American populations. And she really recognized a critical role of cultural and linguistic concordance in building trust and delivering effective care, especially for non-English speaking populations. So a lot of the participants expressed growing pride in their cultural identities, and when they were able to embrace and share their culture, that led to greater comfort and self acceptance, and really opportunities to educate their peers and to build understanding. So, with this cultural pride, it inspired a lot of them to advocate for representation for the OT profession and really to engage in peer education and in diversity initiatives. This was a pretty widely shared theme. And then theme 4 is representation matters, inclusive curriculum and faculty diversity was pretty important for the participants. The sub-theme being inclusive and culturally representative curriculum. So one participant said, I don't think it would be too much of an issue when they're giving examples of clinical examples. At least whenever you're using names of certain people, they can just switch it out for an Asian person's name. In the end, we will be treating people from all different backgrounds. So I do notice that most of the examples they give us, it's usually just like a white patient. So really this participant was saying that the lack of cultural diversity that was experienced in clinical examples and case studies within his program indicated to him that the program was not genuinely inclusive. So he emphasized that OTs will end up working with patients of different backgrounds. So greater representation in educational materials is important for preparing students to provide culturally responsive care. So really the use of only white names of patients in case studies really impacted his sense of belonging within the program. Pertaining to faculty diversity and relatability. If your faculty isn't representative of different cultures, have guest speakers if that's available. Have people come in because bringing in different voices can show not only are we sharing history and culture and being open, but we are bringing in people. We actually value these people. I feel like that shows a lot. That's not just preaching inclusivity, but practicing inclusivity by bringing different people in. If you're not going to hire them, bring them in for a guest lecture or something. So this participant believed that when faculty diversity is limited, programs can still promote inclusion by intentionally bringing in guest speakers, because when we include diverse voices, this can play a significant role in fostering cultural awareness and learning for the students. It also demonstrates a genuine respect and value for diverse communities. And she really viewed it as a way to practice inclusivity, not just preach it. Um, And she really felt that diverse speakers really offer unique lived experiences that provide students with a broader view of clinical practice and really indicate the OT program's commitment to diverse representation. Another quote is, I think it would be important when putting together a department to hire people that either represent the groups they'll most likely be serving, or to ensure that this person they're hiring has the background or the foundation to become more culturally relevant. It would be nice to have an ongoing kind of training for faculty to become better at promoting diversity and equity. I think that each course could have a full module on different cultural factors. So again, this participant believed that having diverse faculty would be important for representation and inclusion within her OT program. And she really felt that faculty members should undergo ongoing cultural training to strengthen their abilities to promote diversity and equity. And that was the best way to adequately teach students how to work with diverse populations. Participants really emphasize the importance of seeing their cultures and identities reflected not only in the curriculum, but they felt like it was really important in the faculty members as well. And they felt that when there was representation, this fostered feelings of understanding and validation and connection. And having diverse faculty members, it really served as relatable role models and sources of support. Many of the participants desired a curriculum that includes broad cultural perspectives that will really prepare them for a culturally sensitive care. And this was a widely shared theme. Um, so, theme 5 is cultural roots and identity formation, cultural values shaping behavior and perspective. So, one student said, my experience is based off my identity as Asian American, based off my personality and upbringing. As a student, I've seen it come out in even ways that we interact with patients and faculty. As someone who is raised in a culture that really has that hierarchy of authority and position, you respect that. And especially when interacting with people like professors or patients who are older. Um, you have that level of respect, and in a way I feel like it's almost hindered me in a sense that it's hard for me to see an individual or even older classmate as future colleagues. I see them as someone who's older than me, someone I should respect, someone whose opinions I should respect. Or even with faculty, when I see classmates of non-Asian descent, they have a much more informal and relaxed and casual relationship with faculty or other students. But I feel that although I am also able to have that, I feel I struggle a bit more trying to not see a classmate or a faculty as someone older, as someone I must respect. I should see them as a future colleague or a classmate. I don't know if that makes sense, but as a student, that's something that I feel I've struggled with, and it makes me sometimes scared to ask questions or more hesitant to ask certain questions because I feel that kind of stopping me. So this participant, she is proud of her cultural heritage, but she also recognized that because of her culture, emphasizing respect for authority figures and older persons, that really shapes the way that she views professors and older classmates. And it makes it hard for her to see them as equals or future colleagues. So as a result, she's kind of hesitant to ask questions in class, and that really creates challenges in her ability to fully engage in her learning environment. But she is still aware that she needs to adapt. Another sub theme for family influence and generational impact. My mom is full Chinese and she was actually born in Vietnam. And just hearing about the way my grandparents had to migrate over here and the things that they had to go through, and then just seeing the way my mom was always working hard to make sure we had at least the basics. I feel really pushed me to be hardworking and get the things that I do want in my life. I think that has definitely helped me in that aspect. I definitely would say I have gotten that from her. And then also just knowing that everything my grandparents went through, I feel like I had to chase that American dream and be that type of success that they've always imagined for their kids and us. So I think it's important and it has pushed me to be hardworking, as I like to say I am. So this participant, she really shared about her family's background, particularly her grandparents' immigration and her mom's hard work, and how that had such a strong influence on her and inspired her to be more determined and hardworking. So she felt a strong sense of responsibility to succeed, not only for herself, but she had to honor the sacrifices that her family had made. And those sacrifices motivated her to pursue success and to live up to the goals that her family hoped for when they came over to the United States. Um, a lot of the participants, They had cultural backgrounds that deeply shaped their identities and values, and identity was really central to their sense of purpose in both their personal and their professional life. A lot of common cultural values were shared amongst the participants, like hard work, respect for authority, commitment to education. And they mentioned that family influence played a really strong role. So they had parents and grandparents who made sacrifices and really had expectations of them, and that fueled academic motivation. This was a pretty strong theme that was also supported by most of the participants. And then lastly, theme 6 is navigating stereotypes and microaggressions in academia. Um, Internalizing academic pressure. So this participant said, well, and there's the model minority myth. So if you're not a smart Asian, then you're dismantling all the Asians around you. So that's even worse because imagine the guilt from that. They think that all Asians are good at math. They try and stereotype. They can't seem to comprehend they think there is no variability in people. So this participant really felt the pressure of the model minority myth, which places expectations on Asian American individuals to meet really high academic standards. And that can be stressful. So, not academically performing well can really lead to feelings of guilt, not just on a personal level, but they feel like they're letting down the whole Asian community. So, this pressure demonstrated that stereotypes, particularly the model minority myth, can really have an emotional burden with unrealistic standards for these students. The impact of stereotyping on sense of belonging. Now, this quote was regarding COVID. I definitely think there was always a lot of talk from other people about us, but then also like the whole Asian hate crimes going on. I was always just very worried about my grandparents because they look more Chinese than I do. And the fact that they don't speak very good English, I was always just worried about them. I was like, what are they doing? Are they staying home? Are they getting everything they needed? But I don't know. It was a strange point in time. I would also receive jokes from people I know, like, oh, you guys brought it over because you ate bats or something like that. And it was just very, very weird. So, this participant was emotionally impacted by the stress of the uptick in Asian hate crimes that surfaced around the COVID-19 pandemic. So, specifically, she felt stress and worry about the well being of her grandparents. And that effect really took a big mental health toll on her, impacting her well being and sense of belonging in her community and also among the people that she knew. So she had a quote that regarding a lot of talk from other people about us indicated that she felt that she was being viewed as different or othered because of her Asian identity. And really navigating the whole COVID-19 pandemic as an Asian person was marked by fear and emotional strain for this participant, and it started to seep into her daily interactions with others and shaped how she related to her community and to others. Um, Another quote, I have had a couple professors get me and the other Asian in my class confused. I've gotten that a lot. Meanwhile, we look very different. For starters, she always wears her hair down and I always have my hair up. I've had a lot of that situation. That's always just annoying and hurtful. First of all, you only have 25 students to memorize and you can't memorize the two of us out of 25. That is not good. So this participant really expressed a lot of frustration over repeatedly being confused with another Asian classmate despite physical differences. And students experienced similar incidences that really led to feelings of disrespect and invisibility, and that ultimately impacted their sense of belonging. So these are just subtle microaggressions that led these participants to feeling excluded and generalized. So these participants experienced this racial stereotyping and microaggressions actually throughout their entire academic journeys. So their emotional well-being was negatively impacted, self-confidence, sense of belonging, and the model minority myth was pretty commonly encountered, creating a lot of internal pressure to excel, adding a lot of stress and academic burden. So participants in the research study really expressed a strong desire to be seen as individuals and avoid being defined by racial assumptions. And once again, this was a pretty strong theme that was supported by the participants. So those were a lot of themes, but there are some implications for education. So firstly, implementing workshops, on microaggressions and stereotypes can really help promote inclusion, allyship, and student well-being in OT programs. Now, however, we do know, as I mentioned before, the current U.S. political and legal shifts are really challenging DEI related efforts. So to adapt, OT programs might want to consider reframing some of these efforts under terms like student support or communication skills so that we can still maintain compliance, but still foster inclusive, supportive environments. So really flexibility and responsiveness are key in navigating this evolving landscape. The other thing is that the student awareness of groups like COTAD and AAPI-OT really varied. So students who were familiar with COTAD and these other groups reported that it helped them to support cultural identity and pride and advocacy. So for faculty members, promoting organizations and OT programs can really enhance belonging and representation and mentorship. So faculty members are encouraged to actively introduce these groups to support inclusion and cultural connection among students because a lot of students are not aware that these groups exist. The other important thing is mentorship programs. So mentorship is really essential for fostering belonging and inclusion in OT education. So when we are able to implement structured mentorship programs, whether that's with faculty or advanced students or alumni, that can really help support academic success and boost confidence and self-efficacy. It can also help students to navigate these challenges and really create a empowering and inclusive learning environment. Faculty development is always going to be important, so OT faculty can play a vital role in fostering inclusion by engaging in professional development and continuing education that are focused on diverse teaching strategies. So even something as simple as using inclusive case studies, culturally relevant examples, helps Asian American students to feel seen and valued. So with growing challenges to DEI programs at some institutions, professional associations like AOTA can provide DEI, JAB resources and conference sessions that are free from federal funding constraints, which help to support faculty efforts to create inclusive learning environments. Um, And lastly, faculty and administrators should actively work to diversify faculty and guest speakers in OT programs. I think that's an important point, if possible, because diverse voices can enrich classroom discussions, can help broaden perspectives, and enhance students' cultural awareness and competence. And really incorporating lived lived experiences and cultural insights really helps to support the development of culturally responsive practitioners and ultimately helps to improve patient care. Sorry, I was on the wrong slide for that one. Um, my research did come with some limitations, as all research does. Firstly, there was a strong emphasis on cultural, racial, and ethnic identity themes. I did use critical race theory and Asian crit, so that was kind of expected, but there could be some confirmatory bias because of the study's focus on Asian crit, and my questions were very race conscious, right, on purpose. But another limitation was member checking. I had 10 participants. I reached out to all 10 of them to ask them to verify the themes, and only 5 of them responded. Of the ones that did respond, though, they did say that everything, they were able to fully validate the results. Um, the other thing is that we are relying on self-reported data. And so when we do that in any type of research, that could lead to self-report bias because participants might misremember, they might exaggerate or present themselves favorably. The other thing is that some of the sub-themes did have lower frequencies, but they're still pretty important. And I thought that they did provide some really, really rich individual insights. So really, in conclusion, what I wanted to do was study the lived experiences of Asian American students in these programs. The participants express a lot of pride in their cultural identity and a strong desire to advocate for their communities, which I really thought was a really beautiful thing. And this research highlights the need for more inclusive teaching, diverse faculty, and culturally responsive learning environments. It really calls for continued efforts to support equity and belonging in OT education. So I didn't want to forget about my research questions, but the first one about the lived experiences of OT students regarding Asianization. Well, they describe their experiences of cultural disconnect, invisibility, and stereotyping within their programs. There was internalized pressure, reclaiming cultural identity emerged shaped by family history, cultural pride, and advocacy. And there were just their narratives really reflected how reconstructive history and dominant norms influence academic belonging and identity formation. Um, so the participants also experienced Asianization. There was a lot of stereotypes and assumptions about their academic abilities. So lots of subtle forms of marginalization, including being the only Asian student in class or clinical settings. So to negotiate these experiences, they employed strategies like seeking peer support, self-advocating, or reframing these moments as opportunities to educate others. How did they experience and negotiate reconstructive history in the OT curriculum? Well, many of them noticed not a lot of faculty diversity and a lack of content that highlighted Asian contributions to OT or culturally diverse approaches to care. And that really represents a gap in reconstructive history. But despite this, some of them really engage in critical self-reflection, and they sought to integrate their heritage and lived experiences into classroom discourse. So these acts served as resistance to dominant narratives and illustrated efforts to reconstruct history from their own perspectives. So I do have a ton of resource references, too many to put on the slide, but I have a QR code here if you'd like to see them. But I know I apologize if that feels a little rushed. It was honestly a very long process, the entire research, and hard to kind of cram into 45 minutes or an hour. But I would love to welcome any questions if you have any.
Thank you so much, Dawn. I mean, all of your themes, the quotes, it just resonated with me, just as an Asian American educator, but seeing the experience that my students have had. And so, yeah, just I felt like it was so consistent with, the experiences that students have reported in the past too. So, yeah, I think the quotes in particular were extremely powerful. Thank you so much for sharing that. That was wonderful. Any questions?
I don't have a question so much as an interesting reflection. I graduated from OT school in with my master's in 2002 from a Northeast school, and I can very well say the experiences of the students were the same for me that many years ago. So what's discouraging is that nothing has shifted in all those years. I was one of two South Asian students. We were often mistaken for one another, despite looking very different from each other. Um, yes, no culturally relevant curriculum, very much. And what was interesting, I was an older student at the time, so I had gone through an undergrad program which was very mixed. This is New York. This is New York State. And then going into an OT school, which is so fundamentally different from a diversity perspective, where I was actually quite surprised how much I had to actually learn about white culture, which I had never. I had to like understand how to navigate white culture for the very first time, and then adjust to it when I entered the profession again, being surrounded by so many other people who didn't look like me, were predominantly white, and again in New York, which was so surprising to me. Um, anyway, so this experience, that was my only comment, which was like, I can't believe what I'm hearing from you now hasn't really changed so much in all those years.
Yeah, I think it's unfortunate. And you know what? It's almost as though in some ways it's gotten worse. I hate to say. So it's just I really enjoyed these interviews so much because we can talk about this like casually, but to actually hear students like talk about their experiences from all over the country was really eye-opening. And to see that, like you said, not much has changes. The same experiences kind of happen everywhere. And yeah, unfortunately, I think in some ways it's we've almost kind of gone backwards from DEI in many
Mhm.
different ways. So it's kind of disheartening to see almost. Yeah.
I agree. Yes, and the composition of the profession really hasn't shifted either in all of
Right. Yeah, absolutely. Because I am one of those people that are always so where I live in Delaware. So, I mean, I'm originally from New York and Connecticut, but
Mhm.
I still am very much the only, everywhere I go, the only Asian educator in the entire college that works full time, the only practicing OT. So it's just, they're very real experiences. So it was nice to kind of hear them.
Yeah, for sure. And offer some solidarity. Or was there an opportunity for these students to connect in any way to create a kind of solidarity, or were they finding it through COTAD and their other associations?
Yeah, just for confidentiality, they're not aware of each other, but I will say that there are a lot of students that are in the same program. And they would say, hey, the snowballing sampling where they're saying, there's this, I talked to someone who's doing this research, so they did talk about, so I did have students of the same cohort, but they don't know of the other ones. So,
Mm, yeah.
Oh, yeah, I think that's really I just want to chime in. I think that is also discouraging to hear that 20 something years apart, and to feel like things may even be worse now. I did want to ask because I was thinking about even my experience with students. I a lot of those microaggressions and stereotypes I definitely saw more prior to 2020. The racial reckoning in our country, the murder of George Floyd. And then there was a lot of conversations around how do we really address this. And so I wondered. Um, I mean, I guess they were all recent students, so this is all post 2020, and they're still experiencing a lot of this, right?
mhm,
Right? Okay.
yeah.
And then I also wanted to check regionally wise, like the diversity across the country. I share this a lot because it's interesting and unique in California, where Asian Americans are actually overrepresented in OT programs. Yeah, it's really unique here. But even though we are overrepresented, we have the representation. Everything else is still the experiences are absolutely still the same. The microaggressions, the um, calling names and not being able to pronounce names, and a lot of those things, those patterns and those stereotypes are still very consistent. So yeah, even with representation, where are we with inclusion and belonging? So yeah, just curious about regionally.
Yeah, I mean, I think, well, with the whole snowballing thing, I would have pockets of students from New York. Um, I don't actually, I'm trying to think, and I did these interviews over a year ago. Like, I'm even trying to think if I even had anybody from California, to be
Mm.
honest with you. But it was different because I would have students that were the only Asian student, and then I would have ones that were the ones in New York, they were amongst a lot of Asian students. I'm trying to think. They were kind of, I mean, I know I mentioned the regions in one of my slides, but some in Arizona, Hawaii, um, New York. I'm trying to think that might actually be, I think there was like one or two in Massachusetts. Um,
Interesting.
yeah, but I will say that to your point, it was interesting because I did talk to a student who actually said that she was raised in a predominantly Asian neighborhood and community, and she had to learn white culture as well. And I thought that was so interesting because that's not something I commonly hear of very often at all. Because for me, it's been the opposite, and just having to that was really eye-opening to me because in my many years of teaching and being alive, these students are so much younger than me. Like, it's not anything I've actually really thought of because you sometimes think of America being predominantly white and, you're coming in and, you're the different one. But in some cases, some of these students that were living in New York City were the ones that were the majority. So I thought that was nice and a very different perspective. But it was so rewarding because I was surprised at the number of students that got emotional. So I think like yeah, I was really surprised at the number of students that got emotional. So it really was empowering for them, I think, to be able to share their stories. So
I can actually relate to that, Dawn. Not from a school perspective, but I was born and raised in Central Jersey, so I was surrounded by a really strong Indian community. And so I was very used to it. And I went to a overrepresented South Asian university as well. And so it was my experience there was different, but then of course the OT department was very white. And so that was different just across campus. But then I moved to Chicago, and that has been a big difference as far as like even within the OT community where our state association is all white. And, most of the OTs I've worked with over the years have been all predominantly white. And I feel like I had a little more representation in Jersey, whereas I came out here and there's like none. And so then I'm
mhm.
the only one who's in all these spaces, and it's just really different.
Yeah. Yeah, there's so much to be said about that sense of belonging. Like I even love just going to the AOTA conferences and going to the AAPI OT meetings and things like that because, you know, I'm I'm not commonly amongst people that, look like us. So, yeah.
I just wanted
That's rewarding.
to off Pooja's point, I also came from a community very represented East Asians, Korean community, Koreatown, LA, all of that. And I would say that the big transition for me was navigating academic white academic spaces. So it really wasn't until I got into academia where it's like, oh, this is very different in terms of just values around leadership and individualism and achievement and I mean, Asians, we all obviously there's a focus on achievement in many of our cultures. And so that was something, that I was raised around. But again, in white spaces, that looked very different. And yeah, I think that was a big shift for me personally. Yeah,
Yeah.
I think we can also do another study on academics,
Right.
API academics, and yeah, you know. Well, thank you so much, Dawn. I know we're just over time, but I think we can just talk on and on about probably our personal experiences and research and academic experiences. So I just appreciate you sharing your knowledge and sharing your research and really kind of pushing the conversation forward, like you're saying, what Yushenta was saying, also like we're not making progress here. So we need to keep having these conversations. I really tried to promote the event to non-AAPI educators, but we didn't see any of them here. And so I'm that's always something that I'm trying to reflect. Like, how do we reach the people that need this information more? I think we have our own lived experiences that we bring to our own settings that we work. But yeah, how to really pull people in. So if you have any ideas or thoughts about that, please let me know. But just want to thank you everyone for being here. I'm going to stop the recording, and then